Good afternoon, everyone. Welcome to today's live stream about Breastfeeding 101. Thank you so much for joining us. My name is Dr. Paris Ikeke. I'm one of the neonatal perinatal medicine specialists here at Michigan Medicine, and I'm going to be your host for today's chat. As a physician, it is very easy to nerd out on the science of breastfeeding. It's so interesting, and that's kind of a whole nother live stream. But as a mom of two young boys, I had babies that both were very small and came earlier than expected. I am acutely aware that life does not always go as planned. So we went through latch issues, clogged ducts, over and under supply at various points in our journey. And I truly feel like life has made me an expert on this topic more than my academic training. But, more than that, I'm very passionate about supporting birthing parents and their babies to help them reach their breastfeeding goals. We know that breastfeeding is one of the most natural and intimate human interactions, but just because it's natural does not mean it's easy. Amen. Whether you're a first-time mom or a mom of four, it's normal to have questions about breastfeeding. And so we are here really kind of to talk about the new tips and tricks and talk about things that moms can share with one another. Our goal for today is to provide helpful information for mothers and their support networks about breastfeeding challenges and best practices, and navigations about transitions like going back to work. We know there's no shortage of advice from well-intentioned family and friends, and even the internet. Hi, TikTok. Hi, Facebook. We're also ready to do some myth busting today and help us kind of sort through the truth. So let's meet our panelists in a moment, but first I want to just do a couple housekeeping items. If you're watching this live, you can submit questions at any time, and we'll pick some of them to be asked during today's chat. Questions can be submitted by commenting on this video directly on whatever platform you're watching from. But please note that if you comment on the platform, your name and your profile name will be visible to others that are participating. If you prefer a more anonymous route, feel free to send us a private message through the Facebook DM function on facebook.com/Michigan Medicine. We know there are going to be some questions that are going to be similar topics, so we'll likely combine some that are going to be on the same topic. And please know that our experts cannot give us specific advice about individual situations that you might be facing, so that might be better to be talked about offline. If you can't stay for the whole chat and you want to share the recording with a friend, it will be available through our Michigan Medicine YouTube channel afterward. So without further ado, let's meet our panelists. I will let these wonderful ladies introduce themselves. Maria, do you want to go first?
Absolutely. Thank you, Paris. I'm Maria Scatulas. I'm a pediatric hospitalist, which means I'm a pediatrician in the hospital. I'm also a board certified lactation consultant. But like Paris, my number one qualification is being a mom. I'm a mom of four. And I've had lots of ups and downs with breastfeeding and draw from all of those experiences.
Good morning, everyone. My name is Kelly McCarley. I'm a clinical nursing director for our postpartum unit and our breastfeeding and lactation program, partnering with Maria on that. My background, I've been an international board certified lactation consultant for about 15 years. I spent 7 years as a volunteer La Leche League leader, providing community support, leading mom-to-mom groups, and then 3 or 4 years as a postpartum and labor and delivery nurse here on our unit, and then about the past 10 years as a lactation consultant, working with our healthy baby population here.
Awesome. Thank you, ladies. And thank you all again for joining us. So now that we've met our experts, let's jump right in with some questions. I do want to just do one final reminder that you can submit the questions directly on the video or by private messaging us on Facebook. We won't use your name when we're reading off the questions, but if you comment on the video directly, your name will be visible to the other participants. So let's get started. Let's say we have an expectant mom. I'm not having any more kids, but we have a mom that is expecting. Is there anything you guys would recommend while they're pregnant to prepare themselves for breastfeeding?
Yeah, I think the best thing you can do while you're pregnant is seek out your support system, learn what resources you have in your area, and take a class. Probably best to take a class late in the second trimester, maybe early third trimester, and those can be really helpful to learn what to expect. If you know that you're going to need a pump because you're going to be separated from your baby, it can be nice to get that while you're still pregnant instead of after your baby is born. But if you don't think you're going to need a pump, you don't have to. I think some people will read that you should prepare your nipples somehow or something like that. I don't think that you really need to do that. Focus more on just taking in all that information during with classes.
Great. There's going to be a lot of supplies, pump supplies, all that stuff. Are any of those things you need to bring to the hospital? What should you bring to the hospital?
That's a good question, Paris. We see a lot of families bring in a lot of things from home. So I think it's always helpful to bring the things that are necessary for you to feel comfortable. But when it comes to breastfeeding, there's really nothing specific you need to bring to the hospital. I think it's important to remember you're here for a very short time in the early days of your breastfeeding journey, and we have everything you need. If you need to use a breast pump, we have breast pumps on the floor for you. I think to Maria's point, if you've secured a personal use breast pump for home and you're not sure how to use that, you're welcome to bring that with you and we can go through that learning process with you. Just understand that we're not experts on every manufacturer's pump. So we have our equipment here. We can help you, but we're always going to direct you back to your manufacturer's website. But nothing special you need to bring. We have everything you need for the time that you're going to be with us here in the hospital.
Great. And I think an important point on that is even if your baby is sick and you plan to be in the hospital for a while, you still really don't need to bring all the extra supplies. We do have breast pumps even in the NICU and on the, pediatric floors. And so we can get you containers to store your milk, labels for your milk, things like that. And so, really try to minimize the additional things that you need to bring to the hospital for your baby. So I have heard about something recently, and thinking about things that are new since I was starting my breastfeeding journey. I've heard about colostrum harvesting. Have you guys heard of that? What is that?
Oh, this is such a hot topic right now. Colostrum harvesting is essentially expressing your colostrum before your baby's born, usually using hand expression. Um, People are looking into it for a lot of different reasons. Um, a lot of people think about using their own colostrum to supplement their baby after their baby's born if you need to. We don't really have a lot of good evidence about how beneficial this is. I don't think it's something people have to do by any means. You have enough going on while you're pregnant. Please don't add one more thing to your to-do list. If it is something you're interested in, there are some videos about hand expression that you can look up, but please don't do it if you have a high-risk pregnancy, and please wait till late in the pregnancy, like 35 or 36 weeks, because you don't want to accidentally start to induce labor too early. I think the other thing to remember is not everyone has a lot of colostrum, and that's not just because you don't have a lot of colostrum doesn't mean you're going to fail at breastfeeding. You might just be one of those people who doesn't have a lot of colostrum, and your milk is going to come in just fine. So don't let it build up your anxiety about how things are going to go after your baby is born. So the bottom line is learning how to hand express can be very helpful. It's a skill that I think people probably need to learn, but you don't have to learn it before your baby's born. You can work on that after your baby comes.
Yeah, absolutely. And I think, the baby's stomach is so, so small, right? And we always have to remind families of how small that belly is. So even just those like couple drops that they get out from the nipple shortly after birth is sufficient to keep them full for hours. So again, just, yeah, minimizing additional stress. It sometimes can be helpful for our families that have histories of diabetes, and so they're concerned that the baby's glucose is going to be low after birth. I think it makes them feel better that they have some of their own milk to offer the baby first, which I think is a very nice thing to do, but definitely not a necessity. So, there's just a lot of information out there. It sounds like, you can read any article and it can say, yes, do hand expression. And another article say, no, don't do it because of this reason. There's a lot of mixed messages that are out there. Do you guys have any go-to sources of information that you can refer our parents to?
So Paris, I always like to recommend we call it a warm line. It's an 800 number that families can call. We do have lactation consultants staffing that number 24/7. They just aren't answering it as a hotline. So you always want to leave a message and we'll get, a response back to you as soon as possible. But if I can give that number, hopefully it'll be in the text as well. But the number is 844-200-8894. I think I got that number. 88. They'll correct me if I'm wrong, but it's just the nicest number to call because you can call at 3 a.m. when you're struggling. You can call before you're delivering your baby if you have questions. And that way you'll get to speak to one of our international board certified lactation consultants to get a good answer for you. We also have a website. The website is full of information. It also links to our education handouts if you want to go a little deeper and have more comprehensive education. So both of those, I think, are my go-to resources for families.
Awesome. Okay. Well, that was very helpful, ladies, I think, as they're preparing for having a baby. But let's say you just had a baby, and you got all the information, but how do I get started in establishing and maintaining my milk supply? What do you guys recommend?
So scheduling feedings, I think, is a common question that families have. And in the beginning, we do talk a little bit about a schedule. That's mainly because you and your baby are so tired from giving birth. So you don't always know what day it is or what time it is or how long it's been since you fed your baby. So sticking to a schedule can just be a nice safety net in those early days. In that regard, we usually encourage you to offer breastfeeding for the baby at least every 3 to 4 hours, knowing that your baby may also be too sleepy to participate. So if the baby's not participating, we can talk about what to do in those cases. But if you can think about every 3 to 4 hours around the clock, your baby should be getting 8 to 12 feedings in that time. Down the road, when you're both recovered and breastfeeding's going well, the schedule is less important. Feeding your baby on demand is what's important at that time. So watching your baby's hunger cues, responding to them. I think, every person is unique in how they eat and how they bond. And so there is no one perfect schedule for every family. But in those early days, first day, 2, 3, 4 of life, you want to kind of be watching a schedule just to keep things safe. Make sure baby's getting what they need.
Yeah, absolutely. And I think, just to expand upon that, if your baby is not going to be going to breast, to make sure that you're also pumping on a schedule and similar schedule of every 3 to 4 hours, even through the night, which is really hard to do, but is really one of the crucial steps to start early when you want to try to establish a full milk supply. And we tell that to our families in the NICU commonly, that, their experience may look a slightly different, but the principle is still there. So that's very helpful for us to kind of get started. I think there is also always a question around what to do at night, and how long can we push the night feeds, because sleep deprivation is real in those early first couple weeks. And so, do you guys have recommendations about how long you can go at night without pumping or feeding? What if my baby starts sleeping through the night at 2 months? And I never had those babies, but if you ever so lucky, is that okay?
That's a really great question. I think it's really important, as you already brought up, to make sure your milk supply is really well established. And that's going to take a couple of weeks at least. Most babies need at least 750 to 900 milliliters a day. And I cannot convert that into ounces in my head right now. I'm so sorry. I'll have to grab my calculator in a second. Once you have that good volume established, though, once your baby is gaining weight steadily and your pediatrician is happy with how weight gain has gone, then I think it's okay for you to space out to once overnight, give yourself a 5 to 6 hour break. And that's not very long. For a baby, sleeping through the night is tops like 5 to 6 hours. So the body is made to maintain milk supply if you have that gap. I wouldn't go much more than that. If you're going much more than that, you're going to risk your supply dropping. So if you're someone who is relying on pumping exclusively, you really need to make sure that your if your baby's getting the bottle, you need to be up pumping too, to make sure that you're maintaining that supply and not going longer than 6 hours.
Great. Yeah, I think that's great advice. It's really hard to be the main source of nutrition sometimes, and it's like it's all on me. So if the baby's up, I have to be up. It's great if you have a partner that can feed a bottle, but one of the questions that may come up for families is when do you introduce that? How do you incorporate a partner into the feeding regimen to introduce bottles? Is there a good time to do that?
That's again, Paris, a really common question we get in the hospital. I think we always say food is love. You feed the people you love. That's how you take care of the people you love. So when the body who gave birth is the body who's making the food, it feels exclusive, and the other parent feels a little left out and is curious how can they bond. And so they're usually looking to bottle feeding as a way to do that. Um, by design, the birthing parent is going to make the milk. So to keep up that supply, bottle feeding isn't a replacement to that. If the other parent is getting up and bottle feeding at night so that the birthing parent can sleep, they're going to miss those feedings and possibly face a decrease in their supply. I think when it comes to bonding, if that is the motivation, there are so many ways to bond with these babies. The babies have so many needs. So we usually talk about all the other needs of the baby. The baby needs to be burped, and the baby needs diaper changes and bath time and story time when they get older. And so each parent can kind of establish their own bonding practices with the baby. And not to forget too, that while the baby is breastfeeding, the other parent can be right there being a part of that experience as well. So it doesn't have to be so exclusive. As far as when though, I think when to introduce a bottle, we'll get into that I think a little later in the talk, but you always want to make sure breastfeeding is pretty well established first. Each course of that is a learning process. So babies are learning to breastfeed, and once they've mastered that skill, you can start working on bottle feeding as a skill if that's something that will be necessary. Usually we say about 4 to 6 weeks after delivery on average.
Yeah, I would agree with that. Great. Okay, so yeah, let's get more into the logistics of feeding and best practices around how to feed. Thinking about direct feeding versus exclusive pumping, there's various reasons why you may be following a different pathway. Some women may think it's easier to just pump and I can see exactly how much is going in and exactly how many wet diapers and poops they have. Maybe that's a better pathway for me, or maybe my baby won't latch, right? And so I want to pump for that reason. Do you have any tips on how to kind of do exclusive pumping as the regimen?
Yeah, I think thinking about your reasons for exclusive pumping, if it's to make sure you know how much is going in exactly, so you can tell the pediatrician how much is going in exactly, you don't have to. I'm a really practical pediatrician and mom of four, so the thought for me of having to pull out a pump for absolutely all the milk was that's a lot. It's an extra job, and then you have to wash the bottle pumps. And I was lucky that my kiddos, by and large, latched, and I only had to use the pump when I was away from them. That's not the case for everyone. I think for the babies who are hospitalized, whether it's from prematurity or because they just are really struggling with latch issues, pumping does come up. I think making sure you have a high quality double electric breast pump is really important. There's a temptation to use maximum settings. You don't need to use maximum settings. You need to pump at a comfortable level. Um, and yeah, pump so that it should feel comfortable. It shouldn't feel like you're traumatizing your nipples. Your nipples shouldn't be turning white while you're pumping. Um, and you have to really watch to make sure you're not causing extra trauma. As Kelly was talking about before, every time your baby needs to eat, you need to be pumping to express that milk. Um, and and that's why it is important to keep it on a schedule if you do have to pump exclusively. I think the other thing is different pumps work for different people. I know that wearables have become really, really popular. They don't work as well for some people. And just watching what your milk supply does with different types of pumps are really important. And what worked for your friend might not work for you, and what worked for someone else on the internet might not work for you. The other thing to think about is like, how much milk do you need? I think we're going to talk about, I think this was maybe a topic we were going to talk about a little bit more later, but you do not need a whole freezer stash. Like, you don't need to buy an extra freezer for all your milk, I promise.
Yes, thank you for that. That is great. Yeah, I mean, I will say from personal experience, I use the wearable a lot because I work in an ICU setting. And so I was like, oh yeah, I need the wearable pump for sure. And I reflecting on my first journey, I got a lot of clogged ducts. I don't feel like I emptied that well. And so this time around, I'm leaning more on my Spectra and so far so good. But yeah, everybody's experience is different, right? And my friend, on her second baby, she still swears by her wearable pump and it's working great for her. So that's great. But yeah, it's just realizing that there's going to be pros and cons to each way that you kind of go about it. And some things may not work for you that might work for someone else. So um, kind of pivoting from that, when you think about breastfeeding and, let's say you have one of the common complaints that I have heard is, my baby's feeding, things seem to be going well at the breast, but they're feeding constantly and, maybe they still look hungry. Should I give my baby formula? When do I know when I need to supplement with formula? Is that always necessary in those early days or not?
So I think it can be so confusing in those early days because like you described, Maria, or maybe it was you, Paris, but the colostrum is so minimal. So if you are hand expressing, if you are using a pump in those early first 2 to 3 days, you're not seeing a whole lot of milk coming out. And so if you're assuming that's what your baby's receiving, you're really concerned about your baby not getting enough to eat. Where with a formula bottle, you can see a good amount of food and that food is gone after you've fed your baby. So you feel good like they got a full meal. I think you have to ask yourself, why am I considering formula? Is it something that you're choosing to do that you know going forward you're going to be doing both formula and breast milk, or do you feel concerned for your baby? So if it's concern for your baby, does your baby look satisfied after feedings? Is your baby making appropriate diapers? Is your baby gaining weight like we expect? Then there's no medical need to give formula. No, you don't have to give formula and breast milk. If it's a baby who was born a little bit early though, and is having a longer time learning how to breastfeed or mastering that skill, that baby may need a little bit of help. And we would always start with your milk first, pumping or hand expressing your own milk. If donor human milk is available, that would be our second choice. And then if the baby still needs additional food, we would consider formula. So it's a situation where it's not a never give formula. It's just understand why the formula is needed. And in general, it's a gradual learning process. And as baby masters a skill, there's usually not a medical need to give that formula.
Yeah, absolutely. And I appreciate you mentioning, Kelly, because we have to remind families a lot too, is that it doesn't always, the supplementation doesn't have to be formula, right? And there are ways to give breast milk supplementation, whether it's your own milk or donor milk. And so that is an important thing to also remember. So you can get the benefits of breast milk and also the extra volume that you're seeking for an indicated reason. But great. The other thing that I think commonly comes up in, thinking about they want the breastfeeding experience to go as smoothly as possible. And someone told them, don't give that baby a pacifier, right? You're going to make them confused. The dreaded nipple confusion conversation. What's the best advice about that? Is it okay to give my baby a pacifier?
This is a big, it depends. If your kiddo was born super early and needs to learn lots of skills, the folks in the NICU, I'm sure will be helping you out with how to use the pacifier to make sure your baby just learns how to use his or her mouth correctly. For kiddos who are born on time and are healthy and don't have extra complications, my general recommendation is to avoid the pacifier for the first couple weeks, just so you can really focus on breastfeeding and learning those skills, because it is skill building. It's when you're learning something new, you have to practice to get it right. After that, by all means, like, you are welcome to give your baby a pacifier. Speaking from my personal experience, my first kiddo would not take a pacifier at all, and my husband and I had to pull out every other technique to soothe that kiddo, because he was just not into a pacifier after breastfeeding was established. My third baby, we got breastfeeding really well established. We introduced a pacifier to her probably about a month of age, and I had to have the dentist tell me to take it away when she was 3 because I just could not get rid of it. So there's not one right answer, and it totally depends on your baby. But my general recommendation is establish breastfeeding first, just so you can practice those skills.
Yeah, I think that's great advice. In an ICU setting, like you alluded to, and there's prematurity and baby is not quite ready to feed, working on oral skills and just that ability to suck is important. So we use pacifiers in that setting. But I will say from experience, reflecting my previous breastfeeding journey with my first son, I do also think that sometimes we probably should have been cluster feeding and putting the baby to breast, but we were putting the pacifier in and he was soothed okay, right? And so he was quiet at that point, but that probably would have helped me build my supply a bit more as being a little bit more responsive to kind of what was going on with him during that time. So that's another thing that I kind of see is not to be kind of falsely reassuring yourselves by just putting the pacifier in, that maybe that's their sign that we want more milk.
I'm so glad you mentioned that point, Paris, because I think, again, I'm in the newborn immediate postpartum phase here in the hospital, the first 24, 48 hours of life. And we are often trying to discourage pacifier use for that very reason. And parents will sometimes interpret our message as it's a no forever. It's a no pacifier forever. It's really a no for this time period because that baby is showing you hunger cues and we need to be responding to those with food. And cluster feeding is a very real thing and it is pretty demanding in those early days. And if we're always responding with a pacifier, we're missing those cues. And now we have a baby that's losing weight and a milk supply that might be struggling. So those cluster feeding and high need feedings are intentional in those early days, and they are not forever either. So it's not a forever no on the pacifier, and it's not a forever cluster feeding situation.
Yeah, great. That's great distinction. Okay, so we're going to kind of pivot a little bit. So we're just giving breast milk at this point. Maybe we need formula, maybe not. But, we've had a couple really hot days this summer. So let's say I have a summer baby. Is a little bit of water okay? I mean, are they going to get dehydrated if it's just breast milk in these really hot days of 95 degrees?
I know that's been on my mind so much. And as I've been rounding in our newborn, on our well babies, I've been talking to families a lot about this. For a brand new baby, all you need is breast milk. It's going to have high water content. Your baby might want to nurse more frequently though, because the breast milk has, just to keep themselves hydrated. And kind of that fore milk is probably going to be a little bit higher in water content, and your hind milk's going to be higher in fat content. So it's not surprising if babies want to feed a little bit more frequently when on those really hot days. Once a kiddo's at least 6 months old, you can consider doing little sips of water, probably out of a sippy cup or something like that. But I wouldn't offer a brand new baby water because their bodies just don't handle water the same way an older baby's body handles water. So you put them at risk of having disturbances in the salts in their blood. So like the salts in their blood can get kind of wonky if you give them water, and that can cause serious medical problems.
Yeah, great. Thank you so much for that. All right. Well, we've talked a lot about kind of the early days. Certainly, as breastfeeding is going well and you're continuing breastfeeding your first child and you find yourself maybe pregnant with your second child, now what do you do? Like, is that a time that I have to now stop giving up breastfeeding this beautiful journey with my first child? What are your guys' recommendations if you find yourself pregnant with the second child and you're still breastfeeding in the first?
You absolutely do not need to stop breastfeeding your first. And again, with low HLE background, lots of experience with tandem breastfeeding. I think if anything, some of the realistic things that can come up, your body is going through changes now. Now you're in a pregnancy and you're starting to change. Your breast can get more sensitive again. Your milk supply may have some flux. So your baby may respond to those fluxes in milk supply. So sometimes breastfeeding that first baby gets a little uncomfortable during a pregnancy. But again, I think handling each situation uniquely. If this is something that you're both still enjoying, if your baby's still needing it, you can absolutely do this safely. It's not something that you need to give up for that first baby. Just knowing that it may be a little more uncomfortable during a pregnancy. And for some, that's kind of the first sign that you know you're pregnant again. You've been breastfeeding the baby and now all of a sudden it's really painful and you start being suspicious that you might be pregnant again.
Yeah, some older babies will actually say that the milk tastes funny because
Yeah.
the milk composition changes once you're pregnant. And that can be a signal that it might be time to take a pregnancy test and find out if you do have another one on the way.
And then
Wow.
I think too, Paris, after that second baby arrives, you can continue to breastfeed both of those babies
Yeah.
together too. And your body will make milk for the youngest baby. So your toddler or older baby that's still breastfeeding gets the benefit of that colostrum all over again. And there will be plenty for the new baby. Parents are always concerned, if I'm breastfeeding both, do I have enough for this brand new baby? Your body is very intuitive and it will make what your babies need and what's being demanded of it. So it's a pretty cool process.
Yeah. Oh my God. This is like my nerd out moment. Yeah, I love this. It's like the science of lactation is just like so interesting. So, how long should you breastfeed for, right? You can do this forever and ever and ever. How long should you breastfeed for? There has been some recent, guidelines that have come out and say maybe do it for 2 years now. What's the current recommendation?
Yeah, I think the American Academy of Pediatrics and the World Health Organization are in agreement that you should breastfeed for ideally you're breastfeeding exclusively for 6 months where your baby is not getting anything but breast milk for the first 6 months of life. Then you introduce complementary foods as dessert and then build up over time for the next 6+ months so that you're breastfeeding for at least the first 2 years of life or the first 24 months. And then it's absolutely okay to go longer. If breastfeeding's going well for both for the dyad for both people, then great, keep going. If you're kind of done, whether it's the mother, whether it's the toddler, um, that's okay too. There's not a perfect age at which to cut off a baby from breastfeeding. You don't have to. Um, I think that I'd have to look up there's some cool anthropological studies about like kind of the natural history of breastfeeding and how
Mhm.
babies will breastfeed into, for the first 2 to 3.5 years of life. And that is what it was historically. Don't quote me on that number. I got to double check my studies, but it's around there. It's a really cool process. And there's still benefits. Like babies' brains are absolutely still developing. And there are a lot of substances in breast milk that are helping a baby's and a toddler's brain grow and have optimal development, things that they don't get from other food sources. The breast milk concentrates too. It actually has like more calories per ounce when a baby's older, like when a baby's closer to a toddler age. So it's a completely different breastfeeding experience at that point because the babies are going to be taking um, smaller volumes, might be breastfeeding like popping on and off pretty quickly. You're not going to be doing those 20-minute sessions that you were with a younger baby. Toddlers are a different nursing experience entirely. So it's clear as mud, but really it's whatever's mutually agreeable for your
Yeah.
breastfeeding dyad.
Yeah, I think there's a lot of sometimes a lot of judgment around toddler nursing and a little bit of like weirdness when they can talk and ask for it, but are still a lot of like wonderful benefits from it as well. So if it's working for you, keep going. So that's great. That's when the breastfeeding journey is it's going well. You're going to keep going as long as it suits you. What if you're having concerns that it's not going that well or your baby's not tolerating your milk? Is there a such thing as like, being sensitive to or intolerant of your breast milk?
Yeah, this one's a tough one. I think we're learning more. I think the most common thing that people worry about is like a cow's milk protein intolerance, and that can show up in different ways. Some babies will get bloody stools from that. Some babies might have struggle with a lot of reflux symptoms. The guidelines have been changing to look at that. I think if your baby has bloody stools, it's really important to see your pediatrician to make sure there's nothing else going on. That's one of those things that as a pediatrician, I like to evaluate the baby and make sure that there's not another cause. For most people, they can eliminate cow's milk protein. Frequently, they might have to eliminate soy as well if that is the cause. Um, and and that can be tough for some. That can be a really tough thing to do, but your baby's gut will heal on its own. There's nothing else special you have to do. And cow's milk proteins exit the breast milk pretty quickly, actually. It just takes your baby's gut a little bit of time to heal. So the milk protein's probably out of your milk within, within a day, easy. But your baby's gut needs a little bit of time to heal. And I think that's probably the most common thing that would cause sensitivity. But
Yeah.
please see your pediatrician if that's going on.
Yes, the dairy-free diet is very exhausting, but it seems to be the most high yield in our population at least. So, but I would say a breast milk given from a mother that's dairy-free is probably the most gentle diet that a baby can experience. So, there's not going to be any formula that's going to be better than that. All right. So let's shift gears a little bit. So we're talking about feeding the baby, but as a mom, I want to do something to feel like myself, and I want to kind of integrate back into adult life and adult activities. Let's talk about some lifestyle questions. What about alcohol? Can I drink when I'm breastfeeding?
So I think that it is okay to have a drink while you're breastfeeding. That's the bottom line. But I think you have to be really thoughtful about how you consume alcohol when you're taking care of babies in general. Um, I think it's a really good idea to make sure it's minimal. I would recommend breastfeeding your baby before you have a drink. Your blood alcohol level is the amount of alcohol your baby's going to see in your breast milk. So so that's why it's better to feed your baby before you have that glass of wine. Um, I think the other situation people think about is they might be going to a wedding or a party and they know they're going to have more drinks. At that point, your blood alcohol level is going to stay pretty elevated for a longer period of time. And you really don't want your baby getting that alcohol. Babies' brains are really sensitive. And it's a good idea to have some milk stored that doesn't have alcohol in it so that that can be fed to your baby instead. It's You don't have to pump and dump per se. That doesn't get the alcohol out faster, but you do have to pump for every time your baby would be fed to make sure that you're maintaining your milk supply. The other thing that I think is just a reality is if you're drinking alcohol, then and if you're intoxicated, you might have to think about who's taking care of your baby. Are you really safe to take care of your baby? And that's just an honest question you have to ask yourself. I think there's an old wives' tale that like a beer will increase your milk supply. That's not true.
Mm.
And actually drinking too much will decrease your milk supply in the long run. So my general answer is yes, it is okay, but be very thoughtful about how much you're drinking.
Okay. All right. So no bachelorette party, but like, maybe a line at the wedding. Sounds legit. Okay. What about caffeine? I love my caffeine. That is one thing. It is very hard to give up. So please tell me we don't have to give up caffeine when we're breastfeeding.
You don't have to give up caffeine. You can have your caffeine.
Okay.
In general, most babies tolerate caffeine just fine. I think if you're an excessive caffeine drinker, pots of coffee a day, or if you're noticing some symptoms in your baby that show that they're having a little difficulty handling it, just play with the amount that you're taking in. But in general, caffeine is completely fine.
Okay, great. And then, one of the other things that comes up when we are talking about, lifestyle, whether it's be kind of recreational or prescribed, is marijuana use. Maybe I need something to take the edge off. Maybe it's for pain control and it's being prescribed by a doctor. What's the official stance on marijuana use and breastfeeding?
Yeah, this is something we're seeing a lot more. I think about the why you're using marijuana. If it's for something like anxiety or a history of trauma and you're looking for things to help you with those symptoms, I really, really encourage people to talk to their own providers, their own mental health professionals, because there are a lot of medications that are safer with breastfeeding and probably more effective than using marijuana. Heavy marijuana use, in particular, is marijuana gets into the milk. Absolutely. The active component of marijuana, THC, we know gets into breast milk and it can be in there for a long time. The studies as to how long it stays in the breast milk really vary, but it absolutely stays in there for a long time. And we know that marijuana affects babies' brains. It is associated with babies having, as they get older, they will have potential learning difficulties. They might have attention difficulties, those we call them developmental difficulties, but you'll see it as kiddos who might have attention difficulties or learning difficulties. So I really recommend that people avoid marijuana while they're breastfeeding. If you are someone who had like tried marijuana socially, it's okay to keep breastfeeding, but I would really talk to your doctor and your baby's doctor about what that looks like for you. Similar to alcohol, if you are intoxicated from marijuana, that would also be a time to think about like, how are you taking care of your baby? Who's watching your baby during that time? And that's just something I tell people whether they're breastfeeding or not, is make sure you have a safe care plan for your baby no matter what. And yeah, I think the final thing I also like to think about is if marijuana is being smoked, your baby's getting secondhand marijuana exposure. So it's a pretty sensitive topic, and we are seeing more marijuana use during pregnancy and breastfeeding. And I really encourage people to figure out the why. Why are you using marijuana, so that we can help you walk that journey and find you the care you need.
Great. Yeah, this is a very controversial topic, and it feels like there's judgment from the medical community, but it's really based in concern about, developmental concerns in that we're seeing in babies from exposure. So thank you so much for that clarification. The other thing that I've kind of heard about recently is fish with mercury, and thinking about like heavy metals and things like that. I've heard about fish in high mercury levels. What about that with breastfeeding? Are we allowed to eat that, or should we just cut it out?
So I think if you think moderation, usually fish 2 to 3 times a week shouldn't be that big of an issue. If you're someone who does consume a lot of fish, the CDC has an excellent website that will kind of rank the fish as far as best to worst choices. I think right now tilapia and trout are among the better choices. So that will be for fish and mercury content specifically. But I will say we get a lot of questions just on foods in general. When you're pregnant, there are so many food restrictions being recommended, and a lot of those are lifted once you've delivered the baby and now you're breastfeeding. So you can have Jimmy John's. That's a huge order here in the hospital because people have been avoiding lunch meat for so long. Soft cheeses. We get some cultural questions. I have a spicy diet at home. Will the spicy diet interfere with my baby? Or I've heard chocolate or onions or so many different things. And I think follow your own diet that is normal for you at your home. That's the diet your baby will grow up and start eating with you. And for the most part, most foods are going to be fine. Moderation is always the generic approach. And if you are someone who consumes a lot of fish, just check that CDC website. I think that can be really helpful to help you make the best choices you can.
Kelly, I'm so glad you brought up the chocolate. I don't think I would have survived being a pediatrician and a mom without caffeine and chocolate.
Yes, that's
Yes.
literally my two vices. Yes.
Yes.
Awesome. Okay, so this is very helpful, ladies. I'm sure this has calmed someone's anxiety around this. So the another source of big anxiety is I'm going back to work. So uh where do we start with that? What do I need? When do I start pumping? There's a lot going on to consider about I'm about to go back to work. Where do we start with that? So when am I going to start pumping? Should I start pumping right away, or do I wait until right before?
Oh, great question, and one that is near and dear to my heart since I did it a handful of times. Um, I really, if you, most people go back to work between 6 and 12 weeks, hopefully closer to that 12 weeks if you're allowed that time. You want to make sure that you really establish your breast milk supply. And if your baby's breastfeeding well, give it a couple weeks. Like, let your baby just feed at breast. That's going to, in the ideal state, that's going to establish your breast milk supply better than anything else. So if you are then going to be separated from your baby, you just need enough milk to feed your baby for the amount of time you're going to be away. So if you know you're going to be away for 2 feeds, then you probably want to have about 10 to 12 ounces in the freezer ready, and that's probably going to be more than enough. Most breastfed babies will take anywhere from 3 to 5 ounces of feed once they're bigger and older, so you don't need that much. And you want to start saving that after your breast milk supply is established, so after that 2 weeks.
Great. Yeah. And, yeah, thinking about like the volume and doing all the calculations on how many ounces do I need for that first day, can be overwhelming. But yes, you do have some time to kind of sort that out until right before you're going back to work. Um, so the other thing I guess is you kind of hit on how many ounces to store in the freezer before you go back to work is probably around that like 1 ounce per hour is what I've kind of have in my head. What I remember is that if you're gone for 12 hours, maybe, around 12 ounces or so. What other things do I need to know about the pump? Like, how do I know what size flange to use and any other supplies that I need to get fitted for?
So flange fitting is kind of another new hot topic, just like colostrum harvesting. I feel like flange fitting was not something talked about 15 years ago when I got into this work, but it's become a really hot topic now. I think when it comes to flange fitting or any other part of using your pump, you have to go with your own comfort level and your own milk removal level. So flanges do fortunately come in different sizes now. When I was pumping, it was a one size fits all. So now they do come in different sizes, which is an advantage. However, nipples vary. They vary in shape, they vary in elasticity. So it is not as simplistic as a sizing element. It's not like a shoe size. You could start with a size that appears to be appropriate and still be uncomfortable and maybe have to change that size again. So I think it's just important for people to understand that it's not, I'm a size this permanently. Your breasts will be changing as you go through lactation. Every woman's breasts are different than the others. So just really go by what feels comfortable for you. It should not be rubbing. It should not be pinching and painful when you're pumping. You should feel that powerful tug, but to a comfortable level. And you should be having good milk removal. At the end of a pumping session, your breast should feel softer. If that's happening, you've got the right size. So I know that's again a muddy, sloppy answer,
Mhm.
but it's not a precision game.
Yeah, it is. It is a
Trial
hard
and error.
topic. Yeah, hard topic. And I had, the concept of elastic nipples is definitely something that's a thing. And then also the concept of the more that you pump and the more you stretch out that nipple, your size changes, right? Like as you go through your pumping journey. And so, it can be very pricey to buy a whole bunch of stuff and then you realize you don't even need it. So, start simple. There is kind of a standard size that comes with a lot of the pumps. And then, I've also tried out some like silicone inserts that I can kind of test out and say, okay, that actually feels better to me. And before I commit to buying all these different sizes of flanges, which can be overwhelming for sure. The other thing that's really overwhelming is how to store the milk, right? There's all these different bags and containers and chillers and things like that. How are you best supposed to store your breast milk when you're away from your baby?
Great question. I think the type of container doesn't necessarily matter. Make sure it's something clean. If your baby's a sick baby who's in the NICU, you want to make sure that you're following your NICU's guidance. They generally want sterilized containers or will give you containers, as Paris said before. I think I always recommend following the CDC's guidelines for how to store your breast milk. And the milk is stable for fresh milk. Fresh milk is stable for 4 hours on the counter. You don't have to put it in a refrigerator. It's stable for 4 days in the refrigerator. And then in the freezer, it's stable for 6 months or up to 12 months, can be acceptable as well. If milk was frozen and then thawed, oh my gosh, guys, I'm losing my voice. If milk was frozen and then thawed, it's stable on the counter for 1 to 2 hours. It's stable in the fridge for 24 hours after it's thawed. And you want to make sure you're not refreezing human milk. One question that's come up recently, we had like some really bad power outages in Michigan a couple years ago. And I was worried, like, what do I do? How do I know if my breast milk's okay? How do I know if my breast milk's still frozen or not. If you still see ice crystals in your breast milk, it's still frozen and okay to be like stay in the freezer. If there are no more ice crystals, that's considered thawed, and it's only good for 24 hours after that. Um, if a baby has started feeding, you want to make sure that milk is from that bottle is used within 2 hours for a healthy baby. Sick babies would have other recommendations, but I always look it up in the CDC's guidelines because I can't remember all those numbers.
Yeah. It's and like you alluded to, if your baby is sick or premature, you're going to be a little even more vigilant and more conservative on that spectrum. But yeah, good advice. And I think, thinking about going back to work and how to package the bottles, thinking about how it may go bad once the baby starts drinking from the bottle. If you send the baby to daycare and they don't really like the bottle and they take one sip and they're like, no, actually, I don't want this bottle because it's not from my mom. Um, you only have an hour or two before that milk has to be discarded, which can be very heartbreaking as a new mom when, you go and the daycare said, oh, we had to throw out a lot of that milk because they drank a little bit. So package very small, like 1 to 2 ounce bottles that you send those first couple of days to week until your baby starts to get into a rhythm and really can consistently take the volumes that you're expecting because it is very, very disheartening to throw away any milk. So,
We do get that question a lot too, Paris. I mentioned babies typically take anywhere from 3 to 5 ounces, pretty much for their whole first year of life for every meal. So if you're freezing 4 to 5 ounce bags, then you can have a couple snack bags, a couple
mm,
1 ounce bags, because they'll go through growth spurts too later in their life. So they may take that 4 ounces and now want just a little bit more. You don't want to thaw a whole nother 4 ounce bag that they're not going to finish. So 4 to 5 ounce for the most feedings, and then a couple little snack bags to cover those other feedings.
yeah, awesome. So let's talk about the logistics of being at work and trying to pump. Where are you supposed to pump at work?
So fortunately, we have the Pump Act now that provides protection for breastfeeding parents. So you should have a clean private space to pump at your work location. It should not be a bathroom. You should also have reasonable break time provided to you in order to pump. So that's something that's available to employees that I don't think there's any limitations now on the sides of the employer. I think this is an expectation for all employees. So that's a very good thing. And that's regardless of gender as well, which is a new point to the Pump Act. So if anyone needs that as a resource to cite, just search the Pump Act. It has all kinds of good information. So you should not be pumping in a bathroom or your car, or you should have clean private space provided to you
Yeah.
and reasonable break time.
Yes, absolutely. Okay. And then I guess how long should we be pumping? So that's another question that I frequently get is how long should the pump session last? And if the employer is asking how many breaks do you need? Oh, we can give you 10 minutes here or there. Is that sufficient? Am I just like pumping a couple, minutes for relief or, what's the optimal time?
Yeah, so I think this is a great time to be honest with your employer. You need to pump as frequently as your baby feeds, and a lot of this depends on how much milk your own breasts store. Some breasts store a lot of milk, and those people can get away with pumping less frequently. Some breasts only store a smaller amount of milk, and those people have to pump more frequently to make sure that you have enough milk for your baby. So the Pump Act covers that you have to be able to make enough milk for your baby. I think when I was pumping, I would tell myself I needed a minimum of 15 minutes, but really it takes probably 20-ish minutes. And that was once I was efficient at it and had like an extra set of pump parts. So I didn't have to wash parts so I could quickly get back to seeing patients. Um, and so I would say you really need to allocate yourself in the ideal world. Kelly, what do you think? I think you need to allocate yourself 30 minutes, but I could get away with shorter if my day was really cramped.
Yeah, I mean, you've got setup time, you've got pump time, you've got cleanup time, you've got walking time back and forth to your work location in the pump room. So to me, 30 minutes is a reasonable amount of time. And I like that the Pump Act uses that reasonable language. They don't define it for you because it can vary person to person. On average, we're usually saying 15, 20 minutes every 3 to 4 hours. That's a really generic schedule, but that's not going to be the right fit for everybody. So I think it's reasonable to ask for that half an hour to take.
Yeah, 100%. Yeah, and I've had some people that it takes them a good 15 minutes to really get that milk flowing well, right? And like by the time you actually start going and filling up the containers, it's like, oh, like my break time's up, you know? So that's also not ideal, right? So thank you, ladies. All right, so we only have a couple more minutes, so I will just try to cover the last couple topics there. The one other topic to wrap up about pumping is kind of, is there a thing as pumping too much? Can you damage your breast by pumping too much?
I think you can unnecessarily be too aggressive with yourself. Yes, with pump or with hand massage or anything. I think people are so, I just meet a lot of moms who are willing to endure a lot of pain for their babies, and they'll be very aggressive with their bodies with either their pump or their hand. And you can cause damage by just causing yourself too much pain that way. So this should be a gentle process. Your pump should be pulling and removing milk, but it should not be painful. Don't turn your suction all the way up. Don't do it for longer periods of time. Longer, stronger does not get you more milk. It causes you pain and damage. So reasonable, again, reasonable comfort, reasonable frequency. Please don't hurt yourself.
Well, and I also notice, you know, when we say, you know, compressions of the breast, sometimes we'll get you a little bit more milk, but like this is not like aggressive compression. Don't hurt yourself. Like, you know, it really shouldn't be that aggressive you know, manual compression of the breast. It's kind of a gentle compression to kind of aid in milk removal. So that's one distinction I also want to kind of shout out. All right, well, we are coming up at the end here. We do have a couple more topics that had come up around just potential complications. Um, but let's talk briefly, just finally around clogged ducts, mastitis. I think that's a big topic that comes up. That's a really big concern for everyone. What's your guys' best advice to prevent that or to treat it if you find yourself in that situation?
Yeah, this is such a great topic. We are learning so much more about mastitis. I think we used to think that mastitis was automatically a prescription for antibiotics because we just didn't know enough. We know a little bit more now, and we realize it's your body having milk that's not being removed effectively. Frequently, it's because you have too much milk, and frequently it's in the setting of exclusive pumping because pumps are just not as good at babies, not as good as babies are at removing milk. So I think it's important to work with a lactation consultant or work with your own physician to figure out if you have too much milk, how do you bring that milk supply down to decrease your risk of mastitis and decrease your risk of clogged ducts. If you are but if you're starting to experience symptoms of a red streaky area on your breast, if you're finding that you're having fevers and really feeling like you have the flu, that's a good time to talk to your provider, your lactation consultants. Rest and ice and fluids are your best friends. Some people do go on to need antibiotics. Um, and it really needs an individualized approach. So I think the one thing I'm really grateful for is that we're learning more, and we're learning that most people don't need antibiotics, which is great because
Yeah.
I struggle. I hate taking antibiotics myself. I use them when I need to for myself and my patients, but if we don't need them, you don't want them.
Awesome. Okay, I think we are out of time. Do we have any closing remarks? Kelly, do you have anything that final words to add for us?
The only thing I like to stress to people, breastfeeding really is an art. It's what attracted me to this work. It's what keeps me doing this work. It's not a one size fits all. There are a lot of creative ways to reach your individual goals. So as you go through this whole journey, yourself and your baby, no matter how long you breastfeed, just kind of have a go with the flow approach. And as things are changing, seek advice and support when you need it. And it may not be the exact plan that your neighbor is following, but we can individualize a plan for you to help you reach your goals. That's what I love about the work.
Awesome. Thank you, ladies, so much for sharing your expertise with us today. I do want to remind the viewers, Michigan Medicine has a broad range of breastfeeding support services that are available on our inpatient side to all the women in Von Voigtlander Women's Hospital Birth Center, as well as the children that are being cared for at CS Mott Children's Hospital. We also offer a range of outpatient breastfeeding clinics across 5 locations. So we're at Brighton, Canton, and then we have 3 locations here in Ann Arbor. And we're actually adding a 6th location in the new Ypsilanti Health Center coming in this fall in September. So we are very excited about that. There is a wealth of online resources for breastfeeding support on our website, which Kelly had mentioned, which we will have linked on the video. And thank you so much to our audience for spending the afternoon with us. We hope that this chat has been helpful to someone. We love to hear your feedback, whether you're commenting on the live stream or through a private message. But thank you so much for joining us.